Intracerebral hemorrhage is the second most common subtype of stroke after an ischemic stroke and usually accounts for approximately 10% to 20% of all the strokes. It has even accounted for an overall incidence of 24.6 per 1 lakh person years and is associated with a high case fatality. Now, with increasing life expectancy, the burden of stroke is likely to increase worldwide. So, what effects should we be warned of? Hello and welcome to Medical Dialogues Journal Club, your daily dose of health and medical news. I am Dr. Nandita Mohan, and today I am going to talk about the early cognitive impairment in intracerebral hemorrhage. The classical presentation of intracerebral hemorrhage is usually a sudden onset of a focal neurological deficit that progresses over minutes to hours with accompanying headache, nausea, vomiting, decreased consciousness, and even elevated blood pressure. Now, rarely patients present with symptoms upon awakening from sleep, whereas neurological deficits are related to the site of parenchymal hemorrhage. Now, to determine the incidence of early cognitive impairment following an intracerebral hemorrhage, a recent study was conducted and reported in the Journal of Associations of Physicians of India. A total of 30 adult patients with diagnosed intracerebral hemorrhage were enrolled in the study. The demographic profile, clinical and radiological profile of the patients were noted. Cognitive status at discharge was assessed using the Montreal Cognitive Assessment Scheme. Now, the majority of the patients were males, and it was found that at discharge, all the patients had cognitive impairment. Majority, that is 76.7%, had moderate cognitive impairment, followed by severe impairment in 16.7% and mild impairment in 6.7%. Only history of tobacco use showed a significant association with severe cognitive impairment. So the researchers therefore concluded that at discharge, mild to moderate cognitive impairment is quite frequent among the intracerebral hemorrhage patients, irrespective of the demographic, clinical as well as the radiological profile. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.